We're talking about lower back pain on this show. I'm Dr. Scott Fuller. We're going to address what is wrong with your lower back, how to solve it conservatively, and how to prevent future issues with your lower back. Now, as we get started, I need to give you a disclaimer first. This is not medical advice, so anything that I talk about in this show and any of the other shows that you look at on my YouTube page is not medical advice. You have to talk with your medical physician first, or your chiropractor, or your therapist before you engage in any of the recommendations that I do here, exercises, nutrition, and supplements, and so forth. But we're going to address what is wrong with your lower back, how you can solve it conservatively, and how to prevent problems and have a happy back. The name of my book, of course, is Happy Back. Some cases do need surgery. I have referred some of my patients for medical consultation for surgery, so that does occur in some cases. But the good news is most cases can be solved conservatively. What I'd like to do is start by telling you some cases, recent cases now in my office, of cases that were solved conservatively with chiropractic care. I have an 81-year-old man, a 91-year-old man, and a 35-year-old man who has come into me recently with lower back pain, acute lower back pain. So starting off, the 91-year-old man had never had chiropractic care in his past. He came in with lower back pain after a slip and fall, and that was a couple of months prior. And then he had lower back pain that continued. No leg pain in this case. So I evaluated him and started taking care of him. In 3 weeks, his lower back pain was gone. What's important about this case and the 81-year-old in a moment is we didn't do any of the traditional chiropractic techniques, the ones that you might be thinking of when you think of chiropractic, which is cracking and popping of bones and so forth. I didn't do that in his case, and he would never be a candidate for that type of treatment or adjustment. The same thing with the 81-year-old. He came in and he had lower back pain over the course of a year. Some of you watching this show might be familiar with this, kind of a more chronic pain scenario. And it got worse and became more and more worse until the fall of 2011, about a year ago. He had back pain and leg pain that was so severe, he ended up in his medical doctor's office. So he had an evaluation, he went for therapy. Now, therapy does work in a lot of cases. It unfortunately didn't work in his case. So it didn't help him, 3 months of therapy. So then he was referred to one of the large hospitals in Boston. He had an evaluation, neurological workup, and a CAT scan. Everything was negative. He also had vascular tests of his legs, which were also negative. He had more therapy, didn't work. Then he was given a variety of prescription drugs, also didn't work. So it's almost about a case of a year now that he was suffering with back and leg pain. And nothing worked. The last thing that they offered him was surgery. And he said, you know, I don't want to have surgery. Luckily, a friend of the family was telling him the whole time, go see Dr. Fuller, try chiropractic. Go see Dr. Fuller, please try chiropractic. He said, no, I'm going to do this first, and so on. Finally, when the surgery word was used, he said, I need to try Dr. Fuller and try chiropractic. So oftentimes this is the case, right? People come to see me as a last resort. So he comes into my office, I do the evaluation, I start working on him. About 3 weeks, we have him now back and leg pain free. This may sound familiar to you as well. He would drive for 5 minutes in his car, and his lower back pain was terrible, sharp shooting pain down one of his legs. He couldn't walk, in his words, he couldn't walk 100 feet without having terrible pain in his legs that he had to stop and rest before he could walk further. About 3 weeks later, we have him walking comfortably outside for 20 minutes with no pain, and he can drive around without any pain either. Excellent, two excellent cases. Neither one of them had prior chiropractic care. The other case is a 35-year-old man. He had a couple of rumbles. 10 months ago, he was working out in a gym, and he had some neck pain, and that resolved. 2 months prior to coming into my office, he was lifting some weights, got some back pain, so he's starting to have a shot across the bow, right? Starting to have some things letting him know this isn't right. So he works out, he gets some lower back pain, but that resolved. About a week before coming into my office, he lifts up a medicine ball to do an exercise in the gym, and he feels sharp low back pain again, but that went away. And then he was packing for a trip, which he then felt severe low back pain that didn't go away at all. So severe low back pain. He said in his words, it took him 20 minutes to get up out of bed. This might unfortunately sound familiar to some of you watching this show as well. 20 minutes to ratchet himself up to the upright position again. So He comes into my office, I do an evaluation. I worked on him every day for 4 days straight. Now, he was leaving on a trip. We weren't sure when he would be able to go on it or not. But we got him from a level 5 or 6 pain out of 10 to about a level 2 by the time he left, and he was able to actually go on his trip. And I've seen this happen way too many times where someone will say, Dr. Fuller, I just sprained my lower back over the weekend, but I'm leaving on vacation tomorrow. Can you fix me today? No is the answer. We can get the problem starting to moving you in the right direction, but in most cases we're not going to be able to solve it in a day. Sorry about that. But we can actually start the process. So those were 3 cases of acute low back pain that actually came around very nicely with conservative chiropractic care. In all 3 cases, we did not do that manual chiropractic treatment that all of you think of when you're thinking of chiropractors, the popping and snapping. More on that later. I'll talk about actually what we did. So in some cases with lower back pain, you might have a variety of symptoms. You might have lower back pain and no leg pain, and you could have leg pain with that as well. Your lower back pain might be stiffness, tiredness, fatigue, aching. It can be sharp pain at times. It might wax and wane. Sometimes it's there, sometimes it's not. Some of you watching the show might have acute lower back pain. This is the first episode you've ever had. Other people, you might have 30 years of lower back pain. We'll talk about that in just a moment. In the leg, you might have also a variety of symptoms in one leg or both legs. You can have pins and needles tingling in the leg. You can have sharp pain, burning, aching. That leg pain might come and go. Again, you can have a variety of symptoms down the leg. This is an important piece of information. If you have severe low back pain, it's sharp, it's the worst ever, and it's not getting any better. If you have any urinary problems, if you have sharp pain going down your leg and your leg is getting progressively weak, that is an emergency situation and you need to treat it as such. Call an emergency room and get yourself in right away and make an urgent call to your medical physician. That is an emergency. We also need to keep in mind there are other sources of low back pain. You can have visceral problems such as a kidney stone that can refer pain into your lower back. And a kidney stone issue, some of you might know, can cause severe lower back pain. It actually feels like a lower back problem, and it's not. I've seen that happen where I've referred that out immediately. You can have other visceral problems. Women with menstrual cycles know during the time of the cycle, some of them get severe lower back pain. So it's a two-way street. The lower back can refer pain outward into the legs and viscera, and the viscera can refer pain back into the lower back. So part of the analysis is to determine what is actually causing your lower back pain. I had 2 recent cases which are very interesting. 2 women runners came to see me. One had knee pain, only in the knee, no low back pain. She had her knee x-rayed and treated, and it didn't get better. She comes in to see me. I evaluated her lower back and I found some trouble in her lower back. Worked on her lower back and the knee pain went away. Very interesting. Second case, also a runner, hip pain. This woman had the hip evaluated, x-rayed, and treated. Didn't get any better. Comes to see me, same deal. No low back pain. I evaluate the lower back, found some trouble there, worked on the lower back, hip pain went away. So we need to keep in mind sometimes these other leg issues may be stemming from the lower back. I even remember a case I had a man who had pain in his big toe, which was mimicking gout, but all the gout tests were negative. I work on the lower back and the toe pain went away. Very interesting. That's how the human body is wired. Let me talk about a chronic lower back pain case. This is one of my favorites. You can actually read this entire testimonial on my website, drscottfuller.com. So this is John. John wrote this in 2005. He came to see me in the year 2000, so a dozen years ago. He said, I could not sit in a chair for more than 20 minutes without experiencing excruciating pain, and it took him 2 to 3 minutes, in his words, to ratchet himself back up to a semi-upright position. He was a rock and roll player, an electric bass player, and he was on the road playing music and traveling in planes and trains and so forth, and that's what did it to him. Years and years of being on the road, and he just couldn't do it anymore. He met me because he had to get away from music and find a different career. As he found himself back in school, he couldn't sit either. So he's sitting and standing and sitting and standing, and that might sound familiar to you as well. He just couldn't get comfortable. Luckily, one of the students in that class was a patient of mine, and she said, you need to go see Dr. Fuller. And John said, no, I don't. I've been to chiropractors and therapists and orthopedists, and I've done everything, and nothing worked. And she said, no, you need to see my chiropractor. So John was convinced to come in, and he said in his words, I knew I'd come to the right place. I felt like I had a trainer in my corner. I had been to many chiropractors before, acupuncturists, acupressurists, medical physicians, faith healers, and so on, and nothing worked. He took every word of advice, every exercise, technique, and recommendation that I gave him. Now, this was chronic low back pain, decades of low back pain that he had. This is why I'm reading this testimonial. Pay attention. For those of you that are at the starting gate with your therapy, heed my words. The road back to health can be a long one, and at times it may seem like nothing will ever get you back to the freedom of movement you desire. And it is all about quality of life, isn't it? Quality of life. I believe that I am a quality of life doctor. If your quality of life is poor because your health is poor, that is where I can intervene and try to help you, whether it's lower back pain or something different. In this case, John's lower back pain was completely deteriorating his life and quality of life. After 18 months of therapy in my office with chiropractic care, he started feeling a lot better, but he said, I still wasn't where I needed to be. So we continued. He doubled the time on the exercises that I gave him at home. We continued working on him. He said, Dr. Fuller never gave up on me, so I didn't give up either. And he said somewhere around the 2-year mark is when he said, I don't have a lower back problem anymore. That's the point that he wanted to make. In his case, it took him 2 years. He felt so good. His quality of life became so much better. He says, I felt like a teenager again. And that's how good I felt being able to run, bike, ski, work out, sometimes pushing the limit. I felt so good. I actually had my life back. Now he sees Dr. Fuller. He sees me once a week for maintenance therapy, more on that later on. What I had given up had been easy considering the reward of living an active, limber, flexible, and pain-free life, putting in all that time and effort. So that's the differences between these cases. There's some acute lower back pain, which only took a few weeks to get better. And here's John's case, which took 2 years. But he never gave up. And I have to say, insurance didn't pay for John's case. There's no insurance that would pay for that amount of therapy. He was paying out of pocket. But in his case, because his quality of life was so bad, it was worth it to him. In a moment, I'm going to get into what's wrong with the lower back and how we take care of it. But before we do, I want to tell you my story. And my story of the lower back, and the reason I'm a chiropractor. So, back in the 70s, my mom and dad both had bad backs. And they went to chiropractors back in the 70s before it was fashionable to do so. They both got great results. And the chiropractor told them at this point, they said, why leave your kids at home to suffer the same fate as you? And they thought, yeah, that's a great idea. Why should we let the kids grow up and then suffer and then bring them in for care? Let's bring them in now. The philosophy is when should you begin dental care? You should begin when you have teeth, right? So when should we begin chiropractic care? When you have a spine. That's the idea. So I started going in for chiropractic care when I was a child, just for maintenance and wellness during the growth and development period. So when I was 15 years old, I got a job as a dishwasher. And I was standing over the sink like this, washing pots and pans and so forth for hours on end, and sure enough, my back was hurting. So I would go to the chiropractor, get relief after a treatment, and then I would go back and do this again. And my back would hurt, and I'm like, this is crazy. I'm 15 years old, why am I having back pain like this? And it took me to figure out when I'm 15 years old that if I stand with my feet far apart like this, right? This is now the now famous Dr. Fuller spread eagle position, right? It's in my book, it's on my videos and everything else. When I stood like this, I'm not bending forward at the waist anymore, and I didn't hurt anymore. So I thought, well, this is excellent. Now I've actually solved the problem. From that point on, I realized taking care of your back is more than just going to the chiropractor. Taking care of your teeth is more than just going to the dentist. Every day you have to exercise your teeth, right? Brush and floss and so forth. Every day you should be taking care of your spine. So when patients come to me, I give them the chiropractic treatment, which is awesome. But I also show them specific exercises, and we get into ergonomics and so forth. I realized that when I was 15 years old. 35-something years later, I'm still doing these things, and my back is way better now than it used to be back then. So that's my story. Let's start talking about what's causing your pain. When people come into my office, they want to know, what's wrong with me, and can you help? So the first thing I do is when I take the long health history that we do in the office, I want to know all aspects about your health, not just about your lower back, but everything from nutrition and medical problems that you've had in the past and so forth. After we take your health history, I offer you a diagnosis. Often the diagnosis is as follows. It's this. You've sprained your back. When you sprain your back, you've injured all of the soft tissues in your back. Now, I'm really good with analogies, so the analogy that I use is the follows. If you roll your ankle and sprain it, you've injured the soft tissues in your ankle. And what tissues did you injure? You injured ligaments, joints, tendons, cartilage, and muscles. The point I'm making is it's not a muscle problem. Almost all of you do not have a primary muscle problem in your lower back. When you sprain your ankle, that's not a muscle problem. It's way worse than that. What you've done is you've injured all the soft tissues. Now, comparing the tissues in an ankle to the lower back, the tissues are the same. Except for in the lower back, there's a lot more moving parts. There's a lot more going on, right? Okay. So in your back, you have cartilage discs, which are the disc spacers in between the bones. You see? You've got ligaments that wrap around the spine to hold it together. On the back side of the spine, you have joints, work like knuckles in my fingers here. These joints are on both sides of your spine that allow you to move. Right? They can become irritated and a source of pain. Of course, you have muscles and tendons crisscrossing everywhere, and they can be a source of pain as well. But the point is when you sprain your back, it's not the muscles that's causing pain, it's all of the soft tissues. Understanding muscle pain is like this. You and I, we go to the gym, we lift some weights, we get sore. Would that last only for a couple of days? Post-workout soreness has a very particular sensation to it. Those of you with lower back pain know that this is way different, isn't it? It's way more than just post-workout soreness. So you've sprained your back. Now, I say you've sprained your back so it's something easy for you to remember and you can take home, and somebody asks you, so what did Dr. Fuller say? Well, I sprained my back. Keep note that this is an important note. When I say you've sprained your back, that includes your discs. And any pain in your lower back that lasts more than a couple of days is a disc problem. That is the primary source of pain. Researchers and medical physicians and so forth have established this for decades now. It's the discs that's causing your pain. Okay. So then, what do we do about it? We have a variety of things that we need to do about it. I'll get into solutions in a moment. But then people ask me, well, how did my spine get messed up? So Dr. Fuller, you analyzed my posture and I'm like this, and then you took x-rays and you said I have too much curve in my lower back or too little curve, and how did my spine get like that? And that's a great question. Using some analogies, if you think of a car, let's say you buy a brand new beautiful car, and driving out of the dealer's lot, you smack a curb with one of the wheels. You knock it out of alignment, but you don't know it's out of alignment. And then you drive 10,000 miles and the car's running beautiful and it's smooth as anything, and all of a sudden, poof, one of the tires blows. You're like, oh my goodness, what happened here? I had no idea I had a tire problem. What was happening is there was a slow wear and tear process because the front end of the car was out of alignment. There's a slow wear and tear process because the spine is out of alignment. But in the early stages, or for many years, it goes unannounced. Interesting. The same thing with teeth. You're going along, you're brushing your teeth, you're flossing your teeth, everything seems fine, you get good dental checkups and so forth. One day, a tooth starts hurting. You go back into the dentist and they do an evaluation. They say, well, you have a cavity. Like, oh my goodness, I had no idea. What happened? And the dentist or hygienist explains to you, well, it was a slow wear and tear process and the enamel wore down and so on and so forth. And it didn't give you any pain until it got so bad, now you have the pain from the cavity. So what should we do in the cases of the car tire and the dental deal? We need to make sure that we correct the problems and then prevent their return if at all possible. And that's what we do here. So you have a wear and tear process. Let's say you have a computer job and you're sitting for 30 years like this, or more commonly like this, right? And then you don't have any pain for 30 years and all of a sudden one day pain starts arriving and you wonder what happens. Well, it was that accumulation of wear and tear over time that built up. Pop onto that the fact that you were born, right? So you get obstetrical manipulation and the force of being born, and then your spine starts off like this. When do you want to take care of this? You know, as the twig is bent, so grows the tree, right? It's so much easier to take care of this when you're younger. I've had babies brought to me in in the carrier like this, and their head is like this after a month, and it's not straightening out. So a couple of very gentle adjustments that they don't even feel, and we can straighten that out right then and there. That saves years of trouble, doesn't it? So it's easy to take care of early on. And then when we're kids, we're running around and crashing into things, and we fall off the playground equipment, and we're sledding and we hit a tree, and then you start playing sports and contact sports and so forth, and gymnastics and football and whatever it might be. And then you sit at a school desk like this for 20 years, and then you get a computer job, and that's another 20 years, right? And then you come in to see me and say, I don't know what happened. Do you happen to know what happened to me, Dr. Fuller? And now I explain it to people. That's what happened. It was a slow wear and tear process over many, many years. Some of you might have an acute injury, of course. You can slip and fall. You can clean out the attic and irritate your discs. You can rake the lawn and vacuum improperly. By the way, make sure you go to my YouTube page. I cover all of those scenarios on the right way and the wrong way. My book, Happy Back, talks all about that as well, preventing lower back pain from occurring. As my colleague, Dr. Stephen Franson, likes to say, sitting is the new smoking. So the more you sit and the more you sit in an improper position and the less you move around, those discs and joints begin that wear and tear process, and they accumulate stress and they start hurting down the road. Sometimes people will have flare-ups, and we identify those flare-ups. Like I said, you raked the lawn and so forth. Some flare-ups are unknown. You don't even know why the lower back pain came aboard, but here it is, and now we need to solve it. So what I do in my office is this. I take the health history. I do an orthopedic neurological examination. If necessary, I take x-rays. Or if you've had some prior studies, I'll look at those prior studies. I develop a diagnosis, and if we think it's a chiropractic case, if I think I can help you, I'll tell you that. And then we lay out a program of care. I gave you some cases earlier where the cases were solved in a few weeks, and that's good. I gave you other cases which take a little longer, John. It takes a couple of years. But the idea is we put you on this path of taking care of things. Now, in my office, I not only do the chiropractic treatments, but I treat you as a whole person. So it might be that you're having some nutrition issues, and we need to address that. People that have extra weight, that's putting extra strain and pressure on their lower back discs and joints. So we need weight loss. We need weight loss for two reasons. One is just weight, and the second one is inflammation. That's a word that's getting a lot of airtime these days now. Inflammation. That means that all the cells and tissues in your body are swelled up a little bit, and they're really angry, and people can get pain from that, ongoing pain. I have a case just recently where a woman had been eating well for a while, and her back felt great, kind of fell off the wagon there a little bit, right? And started eating poorly again, and now she has back pain, but on top of that, her knees hurt, and her elbows, and her thumbs hurt, so she's getting kind of pain everywhere. That's a signal that it's inflammation. So when we got into it during the history, I said, this sounds like it's an inflammatory thing. I think you're actually going to get your best results by a nutrition change. And she thought about it. She said, yeah, when I was really eating well, I felt a lot better. I had a lot less pain. Sometimes it's the nutrition thing that needs to be addressed on top of the chiropractic work. On other people, they need certain supplements because they have deficiencies. So I get into certain supplementation, whether it's the omega-3s from fish oil and antioxidants, vitamin D, probiotics. I make very specific recommendations to people. I try to have people take the right stuff, the best supplements out there, and also not too much. So we try to make the right call with supplements. As I've alluded to, then I put people on exercises. The first visit in my office, you're going to get exercises for your spine. It's like this. I'm your dentist. You come in to see me. You've never been under dental care. I do an examination, and I find that you have a bunch of dental things going on. And I say, okay, we need to correct this. You've got a cavity. You need a root canal, and da-da-da. But I send you home, and I say, this is how you brush your teeth, and this is how you floss your teeth. I'll show you in the office, and I'll show you on videos on my YouTube page. Okay? I do the same thing here. I start teaching you how to take care of your spine because nobody did yet. And that's why it deteriorated over time. So on that first day, you're going to get exercises. And then we start addressing ergonomics. So if you're sitting all day, I'll send you to my YouTube page and I'll say, watch the show that says sitting ergonomics. It talks about managing the sitting position. If you're standing up for more of your job, I'll send you to my video called standing ergonomics, right? Which talks about managing the standing position. And of course, one of them is the famous Dr. Fuller spread eagle, right? So you're not bending forward at the waist and hurting yourself like that. Coming up on the holiday season, a lot of people will stand for hours cooking or wrapping gifts and so forth, and they come into me with lower back pain flare-ups. And sure enough, have to get into managing those positions. I talk about ice and heat in my office. A lot of people come in and people are still told, well, use either one. And in my opinion, that is incorrect. Unless you have some sort of a vascular disorder where you cannot tolerate ice, ice is the way to go. If you sprained your ankle and your ankle is now swollen up and it's hurting, what are you going to do for that? You're going to put ice on it, right? Well, let's say it's a pretty seriously sprained ankle, and a month after care, the swelling has gone down by about 75%. But if I walk for a couple of hours, it starts swelling up again. What am I going to do then? I'm still going to use ice, right? So I always recommend ice. And ice should be 20 minutes on, 2 hours off at least. Make sure that you don't put ice against your skin and so forth. We write this out for people on handouts. Ice is the way to go. Ice is not as comfortable for most people when you put it on, particularly in the winter months, but it's the right thing to do. Heat feels good when it goes on, right? So you feel as though it's therapeutic for you, but heat is actually making your condition worse. So we get into the ice and heat thing. I call it my ice speech, which I just gave you, and I tell people stop the heat, only use ice, and so forth. Then we give work recommendations and workout recommendations. If you have a serious lower back condition, we need to modify those things as well on dealing with work positions. And if you're a workout person, we might have to delay the return. Working with several people right now, which unfortunately, and I love when people exercise, general physical exercise that is, but I work with them and I say, look, you need to hold off for now because if you go back too soon, you're going to injure yourself more and then you have to take more time off. If a professional athlete is injured, the athlete wants to get back on the field, the coaches and team want them back on the field, the audience wants them back on the field, and the doctors and therapists want them back on the field. However, if they go back on too soon and injure it worse, maybe you'll miss the rest of the season. So that's not worth it. We have to make that best call. And then we also have to reintroduce exercises appropriately and workouts appropriately. This next point is very important. Over the past couple of years in my office, I have seen way too many people coming in hurting themselves with new workouts. There are all new kinds of workouts on the market now. DVDs for home, cable television shows, and new workouts in gymnasiums all around. A lot of the philosophies of those workouts I really like. It's not just the weight machines any longer. It's more diverse, and I like that. I also like the philosophies of a little more intensity and so forth. However, everyone needs to be more cautious when they're doing this, particularly for the first time. Just recently, a young guy, he can't be more than 30 years old, started a new workout program, and he was doing a new type of lift, and he caused himself a serious lower back disc injury. He's already been out for a month, and he's probably going to be off of weights for at least another month, just from one new exercise that he tried. Yesterday in my office, one of my patients came in and said, I was at the gym doing this lower back exerciser and my back hurt. I said, guess what? Never do that machine again. So we get into that with patients as well. As a wrap-up, I want to tell you this. It's all about quality of life. When you have acute or chronic lower back pain, and if you experience that now, you know your quality of life has really been impeded. I'm a quality of life doctor and I can help you get back into shape. We do that with chiropractic, nutrition, supplements, specific spinal exercises, and changing your ergonomics. And that way we can get you back to a better quality of life. I'm Dr. Scott Fuller. Please join me again.